So excited to introduce Dr. Emily Molina. Dr. Molina is a rheumatology fellow training at Johns Hopkins. She has a special interest in lifestyle and wellness and autoimmune disease and in patient education. Thank you so much, Dr. Molina, for joining us today. I'm so excited to learn more about lupus and exercise.
Excellent. Okay. Can y'all hear me okay? We're good. Okay, let me share my screen and we'll get this presentation started. Okay, can y'all see this okay? Okay.
No, we can't see your slides.
Okay, hold on one second. One more time. Okay, now can y'all see it?
Yes, it looks great.
Okay, excellent. Thanks, y'all. Okay, so thank you again, Liana, for that wonderful introduction. So I'm Dr. Emily Molina. I'm a rheumatology fellow, and as she mentioned, I have a very special interest in exercise for all of my patients and especially my lupus patients. So we're going to chat about exercise. So exercise is good for our patients. Here's a brief timeline, very brief history of fitness. And so if you think about like way back when, we had the whole primitive hunter-gatherer phase. We were always running around. Hippocrates also actually mentioned exercise in a lot of his work too, which I thought was kind of cool. And then we had the Industrial Revolution, all of our world wars, all of like penicillin, a lot of different medicines, cars, which definitely inhibited our ability to move around in the same way. And then the computer. So we got a lot of reasons to sit and a lot of reasons to not move in the same way. And then we keep on going. Somewhere in the 1960s, there started to be more of a like aerobic program for everybody. There was this really interesting book by a doctor called The Aerobics Program for Total Well-Being. So this is not a new idea. And then Richard Simmons, we all love him, had to include him. And then of course, like starting in the 1980s, we started getting more personal trainers. This actually started to be more of a discussion of like, how do you actually focus on getting away from the computer, away from the television, and actually moving a little bit more. Spinning became a huge fad. And then in 1996, this was actually the first report of the Surgeon General within the United States to actually like focus specifically on physical activity and health, which is obviously critical. And so now we move into the 2000s. And we realize now it's starting to become even more and more of a fad. There's much more things going on. So there's CrossFit, there's Zumba, there's a lot more different opportunities. Gyms are opening up. This is a lot more of a conversation starting more in the 2000s than it was previously. And then in 2008, the Surgeon General actually updated their recommendations. And around that time is also when it's like actually several groups. So it's actually the Sports Medicine, College of Medicine, and then a couple of other United States Health Department came up with this recommendation of 150 minutes per week of moderate or intense physical activity, plus also muscle strength for 2 days per week. So since 2018, that's really been what the recommendation has been. And so when you go to your doctor, they should hopefully know this, and this is what they should tell you, is that this is going to be for your week. You can split it up in a lot of different ways. Most people recommend 30 minutes a day for 5 days because that adds up to 150 minutes, but it really just depends on what works for you. And so key guidelines for adults. So this is part of the most updated edition of Physical Activity Guidelines for Americans for Americans in 2018. And so the most important key part for all of these guidelines is that some physical activity is better than none. So these are the recommendations we just mentioned, and then additional health benefits are also gained by doing other physical activity beyond that, in addition to the strength training, which I mentioned. So what is it for anyone with chronic health conditions? So this is just what it is. So this is what it says for general Americans, all adults. But for anyone who has any chronic health conditions like diabetes, hypertension, rheumatoid arthritis, lupus falls in this category, it's the exact same recommendations. So even more strongly recommended in individuals with chronic disease. So again, the most important thing is just to avoid inactivity, because patients who have a lot of chronic health conditions obviously should be seeking more opportunities to move. So what about today? So exercise and fitness 2023 and beyond. So where are we today? We just talked about the history. We talked about what's been going on previously and kind of what the recommendations currently are. So there's a lot of things that you can do, right? So there's a bunch of different magazines, there's a bunch of different 30-day challenges, a bunch of different brands and gyms and fitness trackers. I think the most important thing, if you walk away with anything from today, is just knowing that exercise is good for our patients. It's good for us. Now, the other thing that I'm going to mention, and this is something that you should also talk to your doctors about, is exercise is also good for your patients' doctors. I can say this because I am a doctor and I talk to my patients about exercise all the time. So if you actually look at, let me move this. So the real exercise habits of physicians, and these are a little bit older data. If you realize it's actually been a while, like if you look at the bottom corner, it's like from the 1980s. There really isn't a lot of data since then. But the Harvard Medical School faculty, actually only less than 50% of them exercised 1 hour a week. And then about 3/4 of California physicians reported exercising also less than 1 hour a week, which is pretty horrible if you think about it. It's really not great. We got a lot of work to do. But and it kind of those particular papers actually broke it down to look at who was doing more exercises and did it matter in their workplace. And so actually the older physicians tend to be exercising a little bit more. So who cares if doctors are exercising, right? Like this is supposed to be for patient advocacy. That's like, why are you telling me this? And so it actually matters because this study came out of Harvard back in 2000, and they were looking at how personal exercise habits of primary care physicians actually affected the way that they counseled their patients. And so doctors who exercised aerobic exercise, so when I say aerobic exercise, I mean things like running, walking, cycling, anything that kind of gets your heart rate up. And they were a lot more likely, by 5 times more likely, to recommend aerobic exercise to their patients. And same thing for patients who exercise in strength training. So like muscle building, dumbbells, weights, things like that. They also were 4.5 times more likely to counsel patients on that. And then older age and longer time in practice actually was negatively associated with counseling for exercise. So patients who were seeing doctors who had been in practice for longer, actually those doctors were a lot less likely to talk to them about this, which I think kind of is a reflection of also the history of how we've addressed exercise in our past. But obviously this is a problem because this study came out in the 90s, but up to 80% of the population actually relies on physicians for recommendations on physical activity. So it wouldn't surprise me if a lot of y'all told me, yeah, I've actually tried talking to my doctor about what should I do when they tell me I should exercise. That's a pretty big deal. And for lupus specifically, those who were counseled by clinicians to do more physical activity actually increased their daily step count by, on average, 1,000 at 8 weeks after the counseling, which is a pretty big deal. That's a lot of steps, especially on a daily basis if you're continuing to do that over 8 weeks. And this is specifically for patients who have lupus. So when I say exercise, what is exercise? So exercise and physical activity are 2 different things. I get this question a lot in clinic. So the difference between physical activity is, I mean, like anything that just requires a certain amount of energy, right? So household activity, doing chores, even just kind of walking around kind of to get from one place to another, that's considered physical activity. Exercise is different because what exercise is it requires a certain amount of planned and structured and repetitive movement. And it's also supposed to be goal-oriented, and that's important because it means that you're spending a specific amount of time to do a specific thing with a hope in mind or certain goal in mind. So let's talk about how to prescribe exercise for patients with lupus. These are a couple of references that I actually really like. If you go to exercisesmedicine.org, it's an initiative of the American College of Sports Medicine. And they actually have, well, this is kind of like their vision, and you can read a little bit more about it. But what I like is that they actually have several different things that they go through, and both in English and in Spanish, for what kinds of exercise they recommend for each of these conditions, which is pretty great. That the American College of Sports Medicine has actually gone through this whole initiative to try to figure out how to answer this question. And I think one of the most important pieces of the whole thing is how to actually start an exercise program. So a lot of y'all, if y'all are joining, you've probably had some interest in exercise already, so you may not need necessarily the step-by-step for how to start an exercise program, but just in case you do, I think it's actually really helpful and it helps line that up. So the step one is just setting aside time to exercise, which in and of itself is actually really hard. Step two is choosing things that you enjoy. So we just heard from Justine, which was a great talk. Thanks, Justine, about how she loves dance and how that's been an excellent part for her lupus warrior journey. And I think that finding something that you enjoy is definitely going to increase your compliance with actually doing whatever that is. And then start early, start easy, something like 10 to 15 minutes a day. And maybe if 10 minutes a day exhausts you, then start with 5 minutes a day, then build up to 7 minutes a day, and just take it one day at a time. You will get there, it just takes time. And then of course, incorporating any strength training. So that's actually more important for people who have certain comorbidities, which I can talk about in a little bit. Okay, so what do we know about exercise and lupus specifically? So in 2017, there was actually a review, and it was a systematic review and meta-analysis for a lot of the papers that were published within the last several years, between 89 and 2016, for exercise interventions in patients who had lupus. And so all of these studies had greater than 5 subjects, like at the very minimum. And so what they found when they actually lumped all of these studies together is that exercise did not cause lupus flares. It did provide the same known cardiovascular benefits that you would see in non-lupus patients, and it improved fatigue. And it also reduced depression, and we know that the fatigue and depression are very common in patients with lupus. And these are things that we talk about in clinic all the time. And they're also things that, patients and people are concerned about. And so the fact that you can do this at home and it helps you feel better and less fatigued, that's wonderful. Okay, so what do we know about exercise inflammation and inflammation? So data suggests that there are actually anti-inflammatory properties of exercise. In the past, there were a lot of people who were concerned that exercise may cause a flare of lupus, but we've actually shown in multiple studies that that is not the case. There are some pro-inflammatory proteins that are upregulated. So what that means is sometimes in order to actually build muscle, that is kind of a more inflammatory process, but it actually over time ends up becoming anti-inflammatory. There's a lot less work done in the autoimmune realm, including lupus, but in general, we have absolutely no reason to think that it actually causes flares, and we have every reason to believe that it's going to be helpful for people in the long term. This paper actually looked specifically, they measured very specific proteins that looked at inflammation. They had patients who at baseline, both lupus patients and healthy controls, they had them walk or jog, depending on what their level of fitness was. And then after each exercise session, they actually took samples of blood to look at what their inflammation markers were. Then they did this 12-week exercise program where it was just 2 times a week. It was a supervised program of 30 to 50 minutes per session. And at the end of the 12 weeks, they did the same thing, and they pulled out some samples and said, okay, where are our inflammatory markers right now? And I don't need to go through all of this slide, but what you can see is that the pre, which means before the study, and then the post, which means after the 12-week intervention. And these are all different proteins that look at inflammation in the blood that we look at. And you can see that some of these actually normalized and came really close to the healthy controls after just about 12 weeks. And some were not affected at all, but some actually got much better. So there are a couple of other notable papers that have looked at the exact same thing, basically 12 weeks of And most of these papers and most of these studies that I'm citing were either 8 to 12 weeks of aerobic exercise. And aerobic exercise, again, means either walking on a treadmill, cycling, or running, or anything that kind of gets your heart rate up in like some kind of an aerobic action. Dancing actually also counts as aerobic activity. And so after they completed this program, it objectively improved cardiovascular fitness and did not increase any type of systemic inflammation. Okay, so what do we know about exercise and other conditions that may occur with lupus? So I'm sure many of y'all know lupus is, it has other things that it can be associated with. So osteoarthritis is one. This is considered the wear and tear arthritis. Usually women are at higher risk for this. And then also just family history, older age, and if you've had a prior joint injury, then that can also be a risk for it. And it, again, keeps company with many other medical conditions. But the universal recommendations by all osteoarthritis experts is that exercise is the first line therapy. So even if you suffer with both lupus and osteoarthritis, we still want you to exercise. And what type of exercise? Pretty much anything that you can do consistently for at least 3 times a week and enjoy. And then these are other things. So whenever we talk about, one of the more common places where you can get osteoarthritis is in your knees. And so running can actually be really painful for patients who have knee osteoarthritis. And so we say lower impact because it's less of an impact and less force on the knee, but that doesn't necessarily mean low intensity. So you can still do cycling and get your heart rate up quite a bit. Okay, so rheumatoid arthritis. This is a different type of arthritis, and it is also common to be overlapping with lupus. So it's an autoimmune inflammatory arthritis. It can affect multiple joints, and it may be associated with lupus. And so what do we know about exercise in rheumatoid arthritis? Actually, a lot of the data that we have actually also suggests that lupus that rheumatoid arthritis also responds very positively to exercise. So these patients trained for 2 sessions a week over 24 weeks, and they were not allowed to do any other exercise. And they found that of the patients who actually did this particular intervention, 4%, they had a 4% increase in total lean body, 8% loss in total fat mass, and then 25% increase in lower extremity strength. So overall, they just got fitter, they got leaner, less fat, and stronger. Unfortunately, what they did is the same group actually looked at these patients with rheumatoid arthritis after a 3-year follow-up, and 0 of the patients continued to exercise, 100% of the patients regained fat, and 100% of the patients lost lean muscle. So we know that this is not something that just happens and goes away. Exercise and maintaining health is truly a day-to-day activity, and it's something that you have to just incorporate as part of your lifestyle, whatever that looks like for you. Yoga is a question that I get asked about yoga a lot, which is why I included this particular study. And we do know that yoga is helpful. It's more of a sedentary activity for the most part, depending on what kind you do. And it actually can be very, very helpful for patients with rheumatoid or osteoarthritis, and it is considered safe. Helps with pain, quality of life, flexibility, and depression. So if anyone is already interested in doing that or has the ability to do that, then that's also something that is considered safe. Yeah. So before making a plan for the future, you have to acknowledge where you have been. So exercise history and goal setting is very important. So this is an example of a 25-year-old patient. She was just diagnosed with lupus a couple of years ago. Before she had lupus, she maybe did some cardio, but not a whole lot. And then in the past 6 months or so, she's been doing more neighborhood walking, maybe 30-minute sessions, 3 days a month. And then in the past 2 weeks, she's doing more dedicated walking. And then now she's considering strength training. So what are her goals? Increase strength and decrease fat. So the most important question to ask this person is, what do you like to do or what do you not like to do? So what you can do. You can refer to physical therapy. You can talk to your doctor if that's something that would be helpful for you. Discussion about any joint concerns. So again, part of the reason why I was talking about arthritis is because that's very common. And so knowing how to manage that, that's the reason why physical therapy is very important and very helpful at actually managing which activities would be safer. Walking is going to be helpful. And then this is a very, very simple example of like progressive resistance training program. And so again, like it's a couple of weeks at one thing, then you kind of progress on to the next. And there are a lot of different adaptations, and a lot of these are things that you can get from your physical therapist. So I just want to share this at the end. So this is Miss Ernestine Shepard. She is the world's oldest bodybuilder. She competed at the age of 71, and she didn't start training until she was 56 years old. So she's now 82, and she's still training at a very high level. So this is just an example of anybody can do if they set their mind to it. Yeah, I love talking about her because I think she's great. So exercise is good for our patients, but it's also just good for everybody. So some motivation is required. So just in summary, fatigue and muscle weakness are very common in lupus. Exercise is a safe and effective intervention. Our lack of knowledge as healthcare providers tends to be a barrier, which is why I like to talk about that with patients, because you should talk to your doctors about these things as well. And then a prescription for exercise should be specific, goal-oriented, and allow for progression. There's much to be learned. We have a lot to learn. But in general, this is a positive thing, and all of the circumstances may require a change in formulation in the dose, but always continue exercising. So I just like to end with this. And I may have been over my time, and if I have, I'm sorry, but that's all I got.
Awesome. Thank you so much, Dr. Molina. I love your talk and all of the great images and all the slides that you had. So if anyone has any questions, please go ahead and start compiling them into the chat. We can have some nice discussions with our experts here tonight. Dr. Molina, I'm going to start with a question for you, if that's okay. So I know you mentioned really just talking to a physical therapist or really listening to your body. And I know I've had events like this on this topic before, and a lot of our lupus warriors are asking about modifications. And I'd love to know if you have had any discussions like this with your patients, and kind of what have you learned from them, or what maybe advice have you given them when they've asked kind of about that modification?
Yeah, so excellent question, Liana. Thank you. So I think in terms of modifications, it depends a lot on the type of exercise that you're planning on doing, and also what the goals are. So I think if the goal is just some kind of exercise and just moving, then finding something that's comfortable that you can do for like regularly that you enjoy, I think would be helpful. So like, for example, sometimes running is really hard for some patients. It can be really painful on the knees. It's a pretty high impact sport. So elliptical is another option. It tends to be a little bit easier, but still gets your heart rate up, or cycling. Usually for cycling, I tend to recommend not the spinning type of class, because you're hunched over and that can be really bad. That can be really hard on your back sometimes. So I tend to recommend one of the like recumbent bicycles, because then you can actually like lay down, or it's not laying down, it's more like your lower back is flat. And so you're not going to be harming your back as much. The other downside that can be a little bit tricky with some patients with arthritis is when you're doing the spinning class, you really have to like kind of hold on to those bars in the front just to kind of help stabilize. And that can also be really painful in the hands. And same thing, actually, there's a lot of different modifications that you can use for people who are interested in lifting weights. So gripping the weights, if you have arthritis, can be really painful. And so there are actually softer weights that are like, they're actually like usually lighter weights, but you can actually get them on Amazon. They're actually like just plush toy type of things that you can use that are actually can be quite heavy. And so those are actually a little bit easier to grip. And sometimes even just using gloves can also be a little bit easier on the hands. So those are, I guess, a couple of things that come up more frequently, but I think a lot of it also depends on the patient themselves, like if they have like specific joint injuries or specific other injuries or things that they're concerned about, then we kind of have to address those.
No, I love those tips, and I think it's great really to listen to your body and ask for modifications if you are interested in a workout. So thank you for that advice. We did have another question in the chat. So it looked like this person is looking for question on just stretching during these periods of flare-ups, kind of more specifically with kind of any treating with prednisone under a flare. So really just curious on if you've heard any kind of connection with stretching during these times, if that's been helpful for patients.
Yeah, so that's a good question. I think during flare, again, every lupus patient is different and every flare is different. And so it makes, again, it's a little bit tricky to what is specific to you. In general, if you find that your typical daily exercise activity is just a little bit too much during your flare, then stretching is definitely something that you should do or you could do, and kind of to help augment that. I would say that stretching isn't a substitute for exercise, but you definitely, if you need a rest day, take a rest day. I think that's fine. There's nothing wrong with that. And it's definitely better than nothing, because the other thing that's positive about stretching, especially during the day or especially in the morning when you tend to be a little bit more stiff, is it does kind of help those juices move and kind of help your body move.
Wonderful. So we did have another question kind of still related to that exercise topic of when you have a flare and you are feeling that extreme fatigue, do you think it is unsafe to try to work out through the fatigue, or how have you guided patients kind of when they're dealing with that?
So that's an excellent question. And I think it depends on the fatigue, because I think in general, we know that light to moderate activity over a long period of time actually helps with fatigue. So I think sometimes your body is telling you you're fatigued and you think you shouldn't do anything, but really the answer is you should do like a walk. And that's very different from when you're in the middle of an acute flare and you're just feeling horrible and you just need to like sit. So it's a bit of a different scenario. I think if you're feeling extremely fatigued, the only downside to doing a lot of more rigorous activities is that you could hurt yourself, just because like you have to be very focused on what you're doing. Like stepping in a different way can injure your ankle or can injure you in different ways. And so I think it just depends on what you're doing. But again, I think a lot of it just depends on what's going on and what's causing that fatigue, and if that's a normal part of your flares. I'm not sure if Dr. Timlin had something else that she wanted to add to that question.
Kind of something similar, kind of to that fatigue and just other symptoms that lupus patients are dealing with, are any breathing problems, and if they may be on oxygen. Do you have any tips kind of really for working through that? And I'm sure it's case by case basis, of course, but kind of any insights to help this patient?
Yeah, absolutely. So there is actually a great reference through the Pulmonary Fibrosis Foundation. And during COVID, a lot of their patients, obviously a lot of the rehab centers for pulmonary rehab were closed down. So they actually included a bunch of different videos online using household activities for things that you can do to kind of help with your own pulmonary rehab. So I can see if I can find that website and pass it over to Leanna. But I tend, for a lot of my patients who have issues with breathing or who need to be on oxygen, I actually refer them to that as well, because it's just household items that you can do, different types of activities at home to kind of help augment your breathing. But you should, if you've never done pulmonary rehabilitation before, you should definitely talk to your doctor about that, because it's a very specific type of physical therapy.
Thank you. I would love that resource if you can find it. And that's really really helpful. Switching gears a little bit, just but still kind of really maintaining focus on kind of that lifestyle of what we can do is diet. I know Tatiana mentioned kind of nutrition and how that plays a large role, or it can play a large role in how you feel. So And we had another event on diet and nutrition that I can share. We can kind of maybe give you more time to go more in depth, but we did have a question on tomatoes. Are they not good for lupus because they might cause flare-ups? Have you heard of that? Is that true? I'd love to know just any advice in regards to that.
Yeah, so that's a good question. I've gotten that question a couple of times actually. And so I think it's not necessarily specific to lupus. If you look on the Johns Hopkins website, Dr. Petrie has put together a list of things that you should avoid if you have lupus. So things like echinacea, alfalfa sprouts, those are on that. Tomatoes are not on that list. The reason tomatoes have been having this like kind of weird new question about whether or not it's good or bad for autoimmune disease is that it's actually considered a nightshade. So it's the same family of fruits and vegetables that are like eggplants and certain other ones, but they actually have a higher concentration of a protein. I think it's a protein actually, some kind of a chemical called choline. And some people aren't able to process that very well. And so that actually can cause people to feel unwell. It just depends on the person. You would know if a tomato caused a flare in you because you ate it and you'd feel bad the next day. But in and of itself, it's not on the typical list of lupus flare-ups like some of those other foods or exposures are.
Perfect, thank you. And again, I can follow up with of an event recording that we had this past May of going more into detail of diet and nutrition and impacts it may have. Another question I just want to highlight, because I've received this question in the past, just about maybe you're taking a walk outside, but just being aware of kind of the impacts of UV light on lupus patients. I wonder if you have any advice on that, Dr. Molina, as you kind of guide your patient through that sensitivity.
Yeah, so that's an excellent question. So actually, Dr. Timlin and I have been working on different mindfulness things within our lupus patients as well. And so I think one thing that I tend to recommend is like, if you go to a quiet place, wherever it is, it's helpful for you. It's the park, it's your home, wherever is quiet and peaceful for you, a place that kind of can make you feel centered and happy. And just take a deep breath and count to 10. That's usually what I tell people to start with. Just because then at the very least, you're focusing on your breath, you're focusing on those numbers, you're just trying to step away from everything else. And then after a while, you realize, oh, I can actually start counting to 10 even slower, and I can sit here for longer, or I can focus a little bit more time on my breath, or I can focus like, how do I feel today? So I think mindfulness is its own talk. You can definitely have many different talks and many different people tell you different ways of doing it, but that's usually the way I introduce it to patients, is just start with just counting to 10 and focusing only on the numbers. So turn off your screens, don't pay attention to anything else, and just breathe.
Perfect. So I'd love to kind of call out to the audience if there's any additional questions for our speakers tonight. I definitely will work with each of them to pull together resources that we've mentioned today on the call and make sure you all can access them. And I'm always here if you have any additional questions and as they kind of come up at a later date. I am going to throw a post-event survey into the chat. And I can also share my screen where I can show you a great QR code, but I'd love to hear any feedback from tonight's event. I hope you guys know that whether you're attending live or watching this recording back, I just know that your feedback is highly valued and really helps shape our programs. And I'd love to know what you thought of tonight's program, and I'd love to know what kind of content you'd like to see in the future. So if you take your phone and use this QR code, it'll take you to a short survey. And then again, I put that link in the chat, but I'll also follow up with the resources and this link in a post-event email as well. I wanted to share that we do have an event coming up towards the end of June June 26th, we have Dr. Tim Kaniecki from Johns Hopkins presenting on Raynaud's and Sjogren's syndrome. It's also a free event taking place on Zoom right at this time, 7 p.m. to 8. So really hope you can get signed up for that program as well if you're interested. Yeah, finally, thank you so much to all of you for attending this evening, and thank you so much to our amazing speakers for joining. And I hope you all have a wonderful and safe evening, and I look forward to talking to you soon.